Assalamualaikum warahmatullahi wabarakatuh. Introduce myself. My name is Suci Amana. I'm from Informatic Management, and today in this presentation we will discuss about childhood cancer. In this presentation, there are several points that I will convey. In the introduction sections, we will discuss the general explanations of cancer. The second point discuss the types of cancer that develop in children. Third, the risk factors and causes of childhood cancer will be discussed in the risk factor sections. On the last point, which is preventions, we will discuss how to prevent and treat cancer in children. So, what is cancer? Cancer is a disease in which some of the body cells grow uncontrollably and spread into other parts of the body. Cancer can start almost anywhere in the human body and affect anyone. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. Sometimes this orderly process breaks down, and abnormal or damaged cells grow and multiply when they shouldn't. The cells may form tumors, which are lumps of tissues. Tumors can be cancerous and are not cancerous. Cancerous tumors spread into or invade nerve tissues and can travel to distant places in the bodies to form new tumors, a process called metastasis. Cancerous tumor may also be called malignant tumors. Many cancer from solid tumors, but cancer of the blood, such as leukemias, generally do not. Benign tumors do not spread into or invade nervous tissues. When removed, benign tumors usually then grow back, whereas cancerous tumors sometimes do. Benign tumors can sometimes be quite large, however. Some can cause serious symptoms or be life-threatening, such as benign tumors in the brain. What what is the difference between adult and child cancer? And this could be caused by four factors. First, the types of cancer are different. Unlike many cancer in adults, childhood cancer are not strongly linked to lifestyle or environmental risk factors. Second, because treatment is often more successful. With some exceptions, childhood cancer tends to respond better to certain treatments. Third, long-term side effects are more of a concern. On the other hand, children's bodies are still growing, and they are more likely to have side effects from some types of treatment. For example, children, especially very young children, are more likely to be affected by radiation therapy. Many cancer treatments also can cause long-term side effects, so children who have had cancer will need careful follow-up for the rest of their lives. Plus, in children with cancer are treated at pediatric cancer centers. In the United States, more children and teens with cancer are treated at a center that is a member of the Children's Oncology Group, or COG. In Indonesia, there is also one. We often call it WKAKAA, or the Indonesian Cancer Child Care Foundations. Types of cancer that develop in children. Number one is leukemia. Leukemia, which are cancer of the bone marrow and blood, are the most common childhood cancer. They account for about 28% of the cancer in children. The most common types in children are acute lymphocytic leukemia and acute myeloid leukemia. Number two is brain and spinal cord tumors. Most brain tumors in children start in the lower parts of the brain, such as the cerebellum or brainstem. They can cause headaches, nausea, vomiting, fluid, or double visions, dizziness, seizures, trouble walking or handling objects, and other symptoms. Spinal cord tumors are less common than brain tumors in both children and adults. Number three is neuroblastoma. Neuroblastoma start in early form of nerve cells found in a developing embryo or fetus. About 6% of childhood cancer are neuroblastomas. This type of cancer develops in infant and young children. It is rare in children older than 10. The tumor can start anywhere, but it usually starts in the belly, where it is noticed as swelling. It can also cause all other symptoms like bone pain and fever. Number 4 is Wilms tumor. Wilms tumor, also called nephroblastoma, start in one, or rarely, but kidneys. It most often found in children about 3 to 4 years old, and it uncommon in older children and adults. It can show up as swelling or lump in the belly. Sometimes the child might have other symptoms like fever, pain, nausea, or poor appetite. Wilms tumor account for about 5% of childhood cancer. Number 5 is lymphoma. Lymphomas start in immune system cells called lymphocytes. The cancer most often start in lymph node or the other lymph tissues, like the tonsils or thymus. They can also affect the bone marrow and other organs. Symptoms depend on where the cancer start and can include weight loss, fever, sweats, tiredness, and lumps under the skin in the neck, arm, or groin. The two main types of lymphoma are Hodgkin lymphoma and non-Hodgkin lymphoma. Both types occur in children and adults. Number 6 is rhabdomyosarcoma. Rhabdomyosarcoma start in cells that normally develop into skeletal muscles. This type of cancer can start nearly any place in the body, including the head and neck, groin, belly, pelvis, and the arm or leg. It may cause pain, swelling, a lump, or both. This is the most common type of soft tissue sarcoma in children. It makes up about 3% of childhood cancer. Number 7 is retinoblastoma. Retinoblastoma is a cancer of the eyes. It accounts for about 2% of childhood cancer. It usually occurs in children around the age 2 and is seldom found in children older than 6. Retinoblastoma are usually found because of parents or doctors notice a child's eye looks unusual. Normally, when you shine a light in a child's eye or take a flash picture, the pupil, the dark up in the center of the eyes, looks red because of the blood in vessels in the back of the eyes. In an eye with retinoblastoma, the pupil often looks white or pink. Last is bone cancer. Cancer can start in the bones. Primary bone cancers occur most often in older children and teens, but they can develop at any age. They account for about 3% of childhood cancer. Two main types of primary bone cancer occur in children is osteosarcoma and Ewing sarcoma. And risk factor. Number 1 is lifestyle and environmental risk factor. In adults, lifestyle-related risk factors such as smoking, being overweight, not getting enough exercise, eating an unhealthy diet, and drinking alcohol play a major role in many types of cancer. But lifestyle factors usually take many years to influence cancer risk, and they are not thought to play much of a role in children cancer. A few environmental factors, such as radiation exposure, have been linked with some types of childhood cancer. Number two is change in genes. In recent years, scientists have begun to understand how certain in the DNA inside our cells and cause them to become center cells. DNA is the chemical that makes up our genes, which control nearly everything our cells do. We usually look like our parents because they are the source of DNA, but DNA affects more than just how we look. It also influences our risk of developing certain diseases, including some kind of cancer. Cancer can be caused by DNA changes that keep oncogenes turned on, or that turn off tumor suppressor genes. So, can childhood cancer be prevented? Unlike many cancers of adults, lifestyle-related risk factors such as smoking don't play much of a role in a child's risk of getting cancer. A few environmental factors such as radiation exposure have been linked with an increased risk of some childhood cancer, but in some cases exposure to radiation might be unavoidable, such as if the child needs radiation therapy to treat another cancer. If your child does develop cancer, it's important to know that extremely unlikely there is anything you or your child could be done to prevent it. So, treating children with cancer, I have 3 points. First, often more than one types of treatment is used. With some exceptions, childhood cancer tend to respond better to certain treatments, such as chemo. This might be because these cancers tend to grow quickly, and chemo works better against fast-growing cancers. Children's bodies are also usually better able to recover from higher doses of chemotherapy than are adults' bodies. Using more intense treatments gives doctors a better chance of treating the cancer effectively, but it can also lead to more short and long-term side effects. Second is the cancer treatment team. Children with cancer and their families have special needs that can best be met at children's cancer centers. Treatment or childhood cancer in this cancer is coordinated by a team of experts who knows the difference between adults and childhood cancers, as well as the unique needs of children with cancer and their families. The last is getting the best treatment possible. Today, the most children with cancer are treated at specialized children cancer center. The centers are often members of the Children's Oncology Group or COG. Going to a hospital that specializes in treating childhood cancer helps ensure that a child gets the best available cancer treatment. So, let's together apply a healthy lifestyle to reduce the risk of getting cancer. I think it's enough for me. Thank you for listening. Thank you for watching. See you next time and have a great day. Assalamualaikum warahmatullahi wabarakatuh.